skin health, right? We all want glowing skin. And I know a few weeks back, I had allergies on my face and it was driving me crazy. So, skin health actually is associated with a lot of internal imbalance. And we want to bring a topic of eczema. Eczema can be horrible. So that's what we want to talk about is if anyone is struggling with any kind of skin rashes, how can naturopathy help you? And we have Dr. Maura with us. Hello, Dr. Maura. Join.
Hello. How are you?
Welcome. Great.
Thanks for having me.
Yes. Thank you so much for joining us. Dr. Maura is one of the leading naturopathic doctors in the country. And she specializes on gut health. Maybe you can tell us what you specialize in before I.
Yeah, I'm a naturopathic doctor. I'm based out of New York City, and I work heavily with a lot of skin issues and kind of getting to the root cause of those. You know, gut, digestive issues are sort of the other big part of my practice, and we often see a big intersection with the two of those. So.
Okay, so let's talk about, we're talking about eczema today, but all the skin health is definitely associated, like kind of correlated, I should say that, right?
Mm-hmm, absolutely.
Yeah, so let's just understand what causes eczema and what are the correlations with the other parts of the body.
So eczema, just to talk about what it is, I mean, it's a chronic inflammatory skin condition. Mm-hmm. There's probably about 7 subsets of eczema, but it affects a lot of people. I mean, keeps my practice busy. We see it a lot in children. It tends to affect about 10% of children. Yeah. And usually there's a very, very strong genetic correlation with eczema. Probably about 70% of people will have mom or dad or both who also suffer from this. So what the cause is, again, it is multifactorial. Typically with any chronic problem, there's going to be multiple causes. The conventional approach to this is more suppressive, right? So people will be given, topical corticosteroids or, antihistamines for the itch and so forth. So, why people end up a lot coming to see us at my practice is because we're actually looking at the root. And so to answer your question, what is the root of this? As I said, it's typically multifactorial, and that's what we try to dig into with all of our patients. It's going to be a little bit different for each person, but the gut correlate is very big, and we see this actually in studies now that a lot of people with eczema have microbiome imbalance. They have overgrowth of certain types of bacteria or candida overgrowth. There's also a big connection with leaky gut, or intestinal permeability, and that's going to drive food sensitivities. And so that's the gut piece. There's actually a lot of other causes of eczema as well, but I'll stop there because I've been talking a lot.
Sure. So gut and skin connection is like the gut has a connection with the mental health, which we have read so much, and the same thing is gut has connection with the skin health, right?
Absolutely. Yeah. We call that the gut skin axis, and
I see.
Yeah, it's an exciting area of study now. All of this research that's going into microbiome is fascinating. In real time, we're seeing, more and more data and research coming out on this. And I'm not sure we fully understand it at a detailed level, but we know more than we did 10 years ago. And as naturopaths, again, we feel very vindicated with this because we've been treating the gut for forever. And now we're seeing, again, these changes in microbiome. There's certain bacteria in the fecal bacterium species subset that we see in much larger numbers in people with eczema. We also see impaired gut lining, right? That gut issue. And what that does is cause a lot of irritation and inflammation in the lining of the gut. Something and a lot of what are called LPS, lipopolysaccharide release, which are inflammatory compounds. And in people with eczema, we find that those LPS structures actually cause inflammation at the level of the skin. So that's where that tie-in is coming from. And so once you've sort of carved that pathway and opened that kind of reactivity in the gut, that's where the food sensitivity piece comes in. Because the immune system is sort of overactive, right? And then, you know, we'll see people with eczema having big reactions to food, typically, you know, eggs, dairy is probably the big one. Wheat, it kind of varies a little bit from person to person, but.
So the thing would be, let's say someone walks in, you obviously need to understand the type of sensitivity, right? Because you're saying the correlation of food sensitivity to the gut lining, which gets impaired, and then that kind of burst into on our skin, right?
Right. It's going to aggravate the skin, and it is different for everybody. You know, to say that every single person with eczema is going to react poorly to dairy is not true. You know, although it's, you know, but there's two ways to kind of test for this. One, you can kind of do an elimination diet totally,
sure,
for a period of time and then reintroduce foods. Or, you know, in my practice, we do blood testing to identify what those foods are. It's, you know, with kids, it's hard too, right? Because oftentimes we'll see eczema coming up in, you know, 3-month-olds or, you know, really little kids, and also you know, kids in general, and probably most people in general, don't like to eliminate food groups, right? Yes. So and it's hard to do it. So that's why we find that the testing is helpful. Although some people are very motivated just to kind of eliminate, you know, all these kind of aggravating foods, and it really does help, actually, probably in a significant way.
Okay, so the 3-month-old is probably being breastfed, and that's
right.
The mom that you have to treat, right?
Exactly. Yeah. So mom has to start eliminating foods and, you know, addressing it that way, which, you know, again, some moms are very motivated, and other times, you know, it's a pain in the neck to do that. But seeing, you know, babies with eczema, we've seen all grades of that, you know, little bits, like little patches to full, you know, to full body. So, and again, a lot of people nowadays are motivated to get at the root. They don't want to just, especially with babies, you know, you don't want to be slathering on steroids, you know, all the time. Yes. So looking and trying to get at why it's happening is motivating.
Sure. So let's just talk a little bit about the toolkit that you use. Of course, food, we are talking about the food elimination diet. In addition to food, are you also using some herbs, you know, overall protocol? What is the protocol?
Yeah. So definitely we look at gut, we look at food, you know, if there's dysbiosis or yeast overgrowth, you know, we'll be using herbs to treat that. You know, and again, that's sort of specific. Probiotics and prebiotics can help quite a bit as well in that sense. You know, gut healing protocols, you know, we use a lot of herbs and amino acids for that. But there's also, to point out one other big cause of eczema, which is that people with eczema, this is where the genetic piece comes in, is that they lack an enzyme called the delta-6 desaturase enzyme, which helps to kind of modulate what are called prostaglandins. They're like, basically it helps to modulate inflammation in the body. So people who don't have this enzyme need help with it. And there's really great, you know, natural anti-inflammatories that drive this, like evening primrose oil is a really wonderful natural anti-inflammatory. We also use fish oils or flax, like a version of omega-3, to help kind of calm the skin down. Because people with eczema, they want relief, right? Yes. This is a really difficult thing and distracting thing to live with. You know, it can be mild, but it can be really severe and really itchy and disrupt sleep. So we want to get inflammation down pretty quick. So yeah, the oils, you know, we'll use, you know, a lot of turmeric to kind of also draw inflammation down as well. Sometimes you know, another thing that we look at is nutrient deficiencies, you know, which can also play in, you know, a zinc deficiency or vitamin C deficiency. So we'll, you know, try to do a little bit of repletion of that. And then, you know, natural antihistamines, right, to address that itch thing I was talking about. So quercetin is one nutrient that we use a lot to get that down, you know, to get that itch down. And then, of course, there's topicals. You know, I mean, again, I'm not opposed to topicals, especially to get people out of that that discomfort. You know, I don't love, the steroids and so forth,
Yes.
to use those in kind of a short measure is okay. But the problem with them is that they're suppressive, right? So they're not getting rid of the problem. They just sort of push it down into the body. And so when you take it away, there's a big rebound effect typically, and a worsening effect. So I definitely encourage people to use the natural topicals like calendula ointment, colloidal oatmeal is another one, coconut oil. Definitely want to keep things moisturized with eczema. That's a big piece of the puzzle. And then we use homeopathy. I mean, I'm a naturopath, so we use a lot of homeopathic remedies as well, which is a whole kind of different arm of medicine.
Yes. Yes. So there's a lot of things that you're doing. It's not just one size fits all. That's number one, right? That's
correct. Correct.
And then the second thing you're doing is so many different therapies. I mean, it's just not only the food, but it's the herbs, it's the oils, it's the homeopathy. It's like maybe something else like stress reduction techniques as well, right?
Stress. Yeah, exactly. Yeah. Anything that's going to, especially in adults who have eczema, anything that's going to aggravate or stress the system is something we have to address, because the skin, especially in people who are eczema prone, it's where things show up for them, right? Yeah. And in homeopathy we call that the psoric miasm. It's where it's kind of they're going to push everything outwards typically. And so and I'm talking about adults specifically, we want to encourage their body to detox appropriately. Is that hormones? Is it cortisol? Is it high stress? Is it even like an emotional kind of trauma piece? You want to get that out of the body along proper channels as opposed to the skin expressing it. So sometimes we'll do detox, we'll do some measure of detox. That's where herbs are helpful, like burdock and milk thistle and, things like that. Also different, homeopathic remedies. Sometimes we'll do, big detoxes, fasts and things like that, just to kind of take the burden off those pathways. Because ultimately the skin, again, is sort of the body's last resort. It's where the body is saying, okay, well, my, the liver's not working, the gut's not working, the lungs to some extent, which are all those detox pathways. Yeah. We're going to use the skin. So can we address these other things? So yeah, eczema is very, very multifactorial. That's why it's frustrating for people, right? Because sometimes people will be eating like the perfect diet, and they still have symptoms. Yeah. It's because you have to address this whole big picture, so.
No, I think it's very complicated, very complex. The way it's not just a small itch here; it's more than that, right? And any questions anyone has? I see people watching. If there are any questions, you're welcome to ask questions right now. If not, you're welcome to send us a DM. We are bringing these topics every single day to really empower and educate you how naturopathic medicine can help you effectively. Anything else you'd like to add, Dr. Maura, before we wrap up today?
I think those are the main things, I think the one thing maybe we didn't touch on are, external environmental factors, because people who are prone to eczema are also typically prone to allergies and asthma, so anything that's going to kind of aggravate from the outside in is something to pay attention to, whether it's, pets or, stuff coming in through, air, contaminated, contaminants in our food, pesticides and so forth. Yeah. So you want to definitely clean things up, eat organic foods, that are going to be clear of all the, kind of things that we don't want to be consuming ultimately. Filter your air. Wool, if you have any kind of wool, people with eczema tend to be very kind of sensitive to that kind of thing. So those would be the things I would look at. If you've tried everything else and nothing is working, address those. Yeah.
Sure. Someone's asking a couple of questions. One is, can SIBO be related to eczema?
It can, yeah. I mean, because SIBO is, small intestine bacterial overgrowth. It's going to cause damage to the lining of the gut, and it's one of our big drivers of leaky gut or intestinal permeability. So yeah, indirectly, it's definitely one of the exacerbators.
Okay. And then following that, someone is asking, how do you diagnose leaky gut? Are there special blood tests or scans?
Yeah, it's a good question. There's probably the main test that we rely on is called a lactulose mannitol test. So you drink a little bit of indigestible sugar, and then we measure how that passes into the urine. And that's typically how we measure it. There's other tests that can also kind of point us in that direction, but that's the main test. And it's also sort of a clinical diagnosis. If we can connect enough dots, then typically we make that assumption. But that's the main test, I would say, for it.
It's a urine test then, right?
It's a urine test, yeah.
Okay, can parasites be cause of eczema? Are there tests to see if you have a parasite? We have a serious questions coming now. So
no, it's a good question. Yeah, yes. I mean, anything that indirectly is going to damage the gut lining and cause gut inflammation, and also change the balance of the microbiome, can be definitely a driver for eczema-prone people. And definitely tests we can do for parasites. We do something in my practice called the comprehensive digestive stool analysis, which does test for parasites. I will say it's not something I see that frequently, as much as I see, SIBO or yeast or dysbiosis, but it certainly can be a cause. Yeah.
And then you can rule it out by doing those GI tests. Right?
Doing GI stool tests, yeah.
Yes,
and even your gastroenterologist can do a parasite test. That's a basic stool and can definitely be an easy test to get done.
Okay. Any other questions, comments, feedback, please, before we wrap up today? This is an amazing session. I love it when people get engaged and they ask questions.
Absolutely.
Yes. All right. I was just waiting for 1 second before we wrap up. Well, anything else you'd like to add before we wrap up? And people what they can do at home by themselves before they come to someone like you? You recommend them, or you want them rather have them reach out to the practitioner immediately?
Yeah, I mean, I'd say the big things, if you're suffering from eczema, start an elimination diet. That's an easy thing to do at home. Yeah. Take a probiotic, take natural anti-inflammatory, pick one, try it, see if it works, trial and error is always a good thing. And if you need help, see a naturopath for sure. Yeah.
We have a couple of more questions who have come up. All right. So is there any correlation between eczema and PCOS? That's the question.
That's a good question. I don't see a direct link there. Polycystic ovarian syndrome is it's sort of an imbalance of androgens that cause infertility and hormonal irregularity. I wouldn't say they cause each other, but there could definitely be people who suffer from both because of these detox pathway issues and nutrient insufficiencies. So again, in my practice, we see people who have 10 things, right? So, at once. So it wouldn't be uncommon for you if you're asking that to be having those simultaneously and maybe for the same reasons. Yeah.
And then someone's asking, can acupuncture help with eczema?
Absolutely. I think, I'm not an acupuncturist, but I think acupuncture can help with everything.
I second that. I also had some, strange allergies on my face a few weeks back. Yeah. Maybe I was doing too many IG sessions.
Yeah.
So I went to an acupuncturist and it helps a lot. Acupuncture helps with a lot of things.
Absolutely. Yeah. It's a full body approach, it's going, working on energy channels, but it's going to rebalance all the things that we talked about in this session. Acupuncture can help support and address. So,
Okay. Any other comments, feedback, questions? Before we wrap up, this is great. So many questions coming up. Absolutely great.
Good questions. Yeah.
Yes. All right. Anything else? All right. I don't see anything. Thank you so much, Dr. Maura, for being with us.
Thanks for having me. I appreciate it.
Yes, absolutely. To all the viewers, feel free to ask us more questions. We are educating you guys every single day on IG and FB. Let us know if there's anything that we are not doing it correctly. I love to get feedback, good or bad, doesn't matter. With that, thank you so much, Dr. Maura, for brought up my heart.
Thank you.
Yes, bye-bye.
Bye-bye.